Okay, so the first thing I would do is go ahead and check the patient's chart, making sure that I have the right patient, room number, and that there's an ABG order in there from the doctor. I'll go ahead and enter the patient's room, introduce myself, address the patient by their last name, and explain to them that the doctors have ordered an ABG sample and arterial blood gas sample, and it's going to be a little bit different. I just have to go ahead and get a blood sample from the arteries versus the veins that the nurses normally do. So the first thing I would do is go ahead, and the patient's okay with that, go ahead and approach the patient, wash my hands, put on some gloves, go ahead and do an Allen's test on the patient. I'm checking for collateral return of the artery on there. So what I would do with the Allen's test, I'll ask the patient to make a fist. I will hold off both arteries, the radial and the ulnar artery, and hold it down for a little bit. And then once the hand starts turning a little bit white, I'll go ahead and lift the radial artery, or the ulnar artery, and see if the patient has good collateral turn. If it does, it's going to start picking up within like 3 to 5 seconds. And so if the patient does have good collateral return, I'll go ahead and start my blood draw. I will go ahead and palpate for the radial artery. I have my alcohol wipe. I'll go ahead and clean the area, making sure that it dries off. I have a 23 gauge needle here. I'll take the cap off. And then what I would do is pull back the syringe to 1.5 milliliters. And I have ensuring that the bevel is facing upward. I'll hold it like a pencil and explain to the patient that I'm going to go ahead and insert the needle on 3 when they're ready. 1, 2, and 3. Insert needle, and I'll go ahead and wait for the sample to fill up. And I have some gauze here already prepped and ready. I have my patient's arm on a towel, so that helps that the artery won't roll away from me. And now I'll go ahead and, now that my syringe is filled, I'll go ahead and take the needle out. I'm putting pressure on the artery at the same time. While I do this, I'll go ahead and cork my needle using whatever safety system that you have for needles. And once I'm holding this for 3 to 5 seconds, I'll go ahead and put a bandage on it here. I will take off the needle and cap it, making sure it's nice and tight. I'll examine my sample, making sure that there's no air bubbles, tapping if I need to. And I'll go ahead and place the sample in the biohazard bag. I have a patient label already filled out, patient's name, temperature that I had taken previously, send it on there and send it off to lab. And go ahead and deglove and wash my hands. And that's it.